Question 1. What is the generic name for the brand name drug Zestril? A. Valsartan. B. Lisinopril. C. Amlodipine. D. Metoprolol. Answer B. Lisinopril. This question tests knowledge of common brand and generic drug names, which is essential for safe medication handling. Zestril is a widely recognized brand name, and knowing its generic counterpart, lisinopril, prevents medication errors. Lisinopril belongs to a class of drugs called ACE inhibitors, primarily used to treat high blood pressure and heart failure. It is critical for pharmacy professionals to quickly identify generic names to ensure patients receive the correct medication. A good way to remember this is to associate Zestril with L4-lisinopril, as both treat similar conditions. Question 2. A prescription calls for 500 mg of amoxicillin suspension, 250 mg per 5 milliliters. How many milliliters, ml, should be dispensed per dose? A. 2, 5 ml. B. 5 milliliters. C. 7, 5 ml. D. 10 milliliters. Answer D. 10 milliliters. This question evaluates a student's ability to perform basic dosage calculations, a fundamental skill for pharmacy technicians. The keyword per dose indicates we need to find the volume equivalent to one 500 mg dose. Using the concentration provided, 250 mg/5 ml, one can set up a simple proportion, 250 mg/5 milliliters, equals 500 mg/x ml. Solving for x shows that 500 mg requires 10 milliliters. Always double-check calculations to ensure patient safety, as administering the wrong dose can have serious consequences. Question 3. Which of the following controlled substance schedules has the highest potential for abuse and no accepted medical use? A. Schedule 2. B. Schedule 3. C. Schedule 4. D. Schedule 1. Answer D. Schedule 1. This question assesses knowledge of controlled substance classifications, a critical area of pharmacy law and patient safety. The key phrases highest potential for abuse and no accepted medical use directly define Schedule 1 drugs. These substances, such as heroin and LSD, are strictly prohibited in medical practice due to their extreme risk. Understanding the different schedules helps pharmacy professionals comply with regulations and protect the public. Remember that Schedule 1 drugs are considered the most dangerous and are not used therapeutically. Question 4. What is the primary purpose of a look-alike, sound-alike, LASA, alert system in a pharmacy? A. To identify expired medications. B. To prevent medication errors due to similar names. C. To track drug inventory levels. D. To manage patient insurance claims. Answer B. To prevent medication errors due to similar names. This question focuses on quality assurance and patient safety, specifically addressing the risk of loss of medications. The keywords look alike, sound alike clearly point to the issue of drug names that are easily confused. A LASA alert system helps pharmacy staff distinguish between medications with similar names, such as hydroxyzine and hydralazine, to avoid dispensing the wrong drug. Implementing these safeguards is crucial for reducing medication errors and ensuring patients receive their correct treatment. Always be extra cautious when handling medications with similar names to prevent potentially harmful mix-ups. Question 5. A prescription reads, naproxen 500 mg, take 1 tablet by mouth twice daily for 10 days. How many tablets should be dispensed? A. 10 tablets. B. 20 tablets. C. 30 tablets. D. 40 tablets. Answer B. 20 tablets. This question tests a student's ability to calculate the day supply or total quantity of medication needed, which is a common task in pharmacy practice. The instruction, take 1 tablet by mouth twice daily, means the patient will take 2 tablets per day. Since the prescription is for 10 days, simply multiply the daily dose by the number of days. 2 tablets/day * 10 days equals 20 tablets. Accurate day supply calculations ensure patients have enough medication and help prevent unnecessary refills. Question 6. Which of the following is an example of an antifungal medication? A. Amoxicillin. B. Fluconazole. C. Prednisone. D. Metformin. Answer B. Fluconazole. This question tests knowledge of basic drug classifications and their uses, an important aspect of understanding pharmacotherapy. The keyword antifungal indicates a drug used to treat fungal infections. Fluconazole is a well-known systemic antifungal agent commonly prescribed for conditions like yeast infections. Amoxicillin is an antibiotic, prednisone is a corticosteroid, and metformin is an antidiabetic, highlighting the distinct categories. Recognizing drug classes helps in understanding a medication's purpose and potential side effects. Question 7. What does the abbreviation BID mean on a prescription? A. Once daily. B. Twice daily. C. 3 times daily. D. At bedtime. Answer B. Twice daily. This question assesses knowledge of common Latin abbreviations used in prescriptions, which is essential for accurate medication dispensing. The abbreviation BID is universally recognized in healthcare to mean bis in die, or twice daily. Misinterpreting such abbreviations can lead to serious dosing errors. Always clarify any ambiguous abbreviations or unfamiliar terms on a prescription to ensure patient safety. Question 8. The beyond use date, BUD, for a non-aqueous compounded preparation is generally no later than 6 months or the earliest expiration date of any active pharmaceutical ingredient, whichever is shorter. What does a beyond use date represent? A. The date the product was manufactured. B. The date after which a compounded preparation should not be used. C. The date the raw ingredients expire. D. The date the prescription was filled. Answer B. The date after which a compounded preparation should not be used. This question focuses on the concept of beyond use dates, BUD, a critical component of sterile and non-sterile compounding. The keyword beyond use date specifically refers to the time limit for which a compounded preparation can be used, ensuring its stability and sterility are maintained. Unlike an expiration date on a manufactured product, BUD is assigned by the compounding pharmacy. Adhering to BUDs is crucial for patient safety, as using a medication past its BUD could mean it has lost potency or become contaminated. Question 9. Which of the following medications is a common beta blocker used to treat high blood pressure? A. Atorvastatin. B. Lisinopril. C. Metoprolol. D. Furosemide. Answer C. Metoprolol. This question tests the understanding of common drug classes and their associated medications. The term beta blocker refers to a class of drugs primarily used to treat cardiovascular conditions like high blood pressure and angina. Metoprolol is a classic example of a beta blocker. Atorvastatin is a statin, lisinopril is an ACE inhibitor, and furosemide is a diuretic, highlighting the distinct pharmacological categories. Knowing drug classes helps to predict a drug's effects and potential side effects. Question 10. According to federal law, how long must records for controlled substances be kept? A. 1 year. B. 2 years. C. 3 years. D. 5 years. Answer B. 2 years. This question tests knowledge of federal pharmacy law concerning record keeping for controlled substances. The phrase federal law is the key indicator, specifying the minimum requirement. Federal regulations, particularly those from the DEA, mandate that all records pertaining to controlled substances must be maintained for at least 2 years. Proper record keeping is vital for accountability, preventing diversion, and ensuring compliance with regulatory bodies. Always be diligent in maintaining accurate and accessible records for controlled substances. Question 11. What is the purpose of an auxiliary label that says "take with food"? A. To improve the drug's absorption. B. To reduce stomach upset. C. To increase the drug's effectiveness. D. To prevent drowsiness. Answer B. To reduce stomach upset. This question assesses understanding of common auxiliary labels and their practical implications for patients. The instruction "take with food" is a crucial piece of patient counseling information, primarily aimed at minimizing gastrointestinal irritation or nausea that some medications can cause. While food can sometimes affect absorption, the primary reason for this specific label is patient comfort and adherence. Always explain the purpose of auxiliary labels clearly to patients to ensure proper medication use and reduce side effects. Question 12. A pharmacy technician is preparing an 4 solution. The order is for 1,000 milliliters of D5W to be infused over 8 hours. What is the infusion rate in ml/hour? A. 100 milliliters per hour. B. 125 milliliters per hour. C. 150 milliliters per hour. D. 200 milliliters per hour. Answer B. 125 milliliters per hour. This question tests a common pharmacy calculation related to 4 flow rates, essential for safe medication administration in hospital settings. To find the infusion rate in ml/hour, divide the total volume, 1,000 ml, by the total infusion time, 8 hours. So, 1,000 milliliters/8 hours equals 125 milliliters per hour. Accurate calculation of infusion rates prevents fluid overload or underdosing and ensures patients receive their medication as intended. Question 13. Which of the following is a common side effect associated with statin medications like atorvastatin, Lipitor? A. Hypoglycemia. B. Muscle pain, myalgia. C. Constipation. D. Increased blood pressure. Answer B. Muscle pain, myalgia. This question tests knowledge of common drug side effects, specifically for the statin class of medications. The keyword statin should immediately bring to mind their primary use in lowering cholesterol and their well-known adverse effect. Muscle pain, or myalgia, and more severely rhabdomyolysis, are significant concerns with statin therapy that patients should be aware of. Understanding common side effects helps pharmacy professionals counsel patients effectively and identify potential drug-related problems. Always remind patients taking statins to report any unexplained muscle pain or weakness to their doctor. Question 14. What is the most critical aspect of aseptic technique when preparing sterile compounds? A. Wearing a lab coat. B. Wiping down the compounding area with alcohol. C. Hand hygiene and garbing. D. Labeling the final product correctly. Answer: C. Hand hygiene and garbing. This question focuses on the fundamental principles of aseptic technique in sterile compounding, a critical skill for preventing contamination. While all options contribute to a safe compounding environment, hand hygiene and garbing are the most critical initial steps. Thorough hand washing and donning appropriate personal protective equipment, PPE, like gloves, gowns, and masks directly minimize microbial contamination from the compounder. Proper aseptic technique is paramount to ensure the safety and sterility of injectable medications. Question 15. A patient on warfarin, Coumadin, therapy should be advised to avoid consuming large, inconsistent amounts of foods rich in which vitamin? A. Vitamin B12. B. Vitamin C. C. Vitamin K. D. Vitamin D. Answer: C. Vitamin K. This question addresses a significant drug-food interaction, specifically with the anticoagulant warfarin. The key concept is that warfarin's effectiveness is closely tied to vitamin K intake, which plays a vital role in blood clotting. Consuming inconsistent amounts of vitamin K-rich foods, like leafy green vegetables, can alter warfarin's anticoagulant effect, leading to either increased bleeding risk or clot formation. Counseling patients on dietary considerations is crucial for managing warfarin therapy safely and effectively. Question 16. When a patient requests a refill for a prescription, what is the first step a pharmacy technician should typically take? A. Dispense the medication immediately. B. Check the patient's insurance coverage. C. Verify if there are remaining refills and if the prescription is still valid. D. Contact the prescriber for a new prescription. Answer: C. Verify if there are remaining refills and if the prescription is still valid. This question tests the essential workflow steps for prescription refills in a pharmacy setting. The keyword first step guides the answer towards the initial check for prescription validity. Before any other action, it is imperative to confirm that the prescription has authorized refills remaining and that it has not expired. This ensures compliance with legal requirements and prevents unauthorized dispensing. Always start by verifying the prescription's validity to streamline the refill process. Question 17. Which of the following DEA forms is used by a pharmacy to order Schedule II controlled substances? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 363. Answer: C. DEA Form 222. This question assesses knowledge of specific DEA forms and their purposes, a vital part of controlled substance regulations. The specific mention of Schedule II controlled substances and order immediately points to DEA Form 222. This form is a triplicate form used for the ordering, transfer, and return of Schedule II drugs, ensuring strict accountability. Knowing the correct DEA forms is essential for legal compliance and preventing diversion of controlled medications. Question 18. What is the primary indication for the generic medication omeprazole? A. High cholesterol. B. Depression. C. Acid reflux/GERD. D. Diabetes. Answer: C. Acid reflux/GERD. This question tests knowledge of common generic medications and their primary indications. Omeprazole is a widely recognized proton pump inhibitor, PPI, and its main use is to reduce stomach acid production. It is commonly prescribed for conditions like acid reflux, gastroesophageal reflux disease, GERD, and ulcers. Knowing the indications of commonly prescribed drugs is fundamental for counseling patients and identifying potential medication-related issues. Think O for omeprazole and O for over-acid conditions. Question 19. A patient weighs 110 pounds. What is this patient's weight in kilograms, kg? 1 kg equals 2 lbs. A. 25 kilograms. B. 50 kilograms. C. 110 kilograms. D. 242 kilograms. Answer, B. 50 kilograms. This question assesses a crucial mathematical conversion skill, converting pounds to kilograms, which is frequently required for pediatric and weight-based dosing. The key conversion factor to remember is that 1 kilogram equals 2 pounds. To convert pounds to kilograms, divide the weight in pounds by 110 lbs/2 lbs/kg equals 50 kilograms. Accurate weight conversions are essential for calculating correct drug dosages and ensuring patient safety. Question 20. Which of the following best describes the main purpose of HIPAA regulations in pharmacy practice? A. To regulate drug prices. B. To ensure patient privacy and protected health information, PHI, security. C. To control the distribution of controlled substances. D. To standardize drug labeling requirements. Answer, B. To ensure patient privacy and protected health information, PHI, security. This question tests understanding of HIPAA, Health Insurance Portability and Accountability Act, a foundational law in healthcare. The keyword HIPAA should immediately trigger the concept of patient privacy and the protection of their health information. HIPAA regulations establish national standards for the security of protected health information, PHI, ensuring patient confidentiality in all healthcare settings, including pharmacies. Adhering to HIPAA is crucial for maintaining patient trust and avoiding legal penalties. Question 21. What does FIFO stand for in the context of pharmacy inventory management? A. First in, first out. B. Fast in, fast out. C. Follow in, follow out. D. Final in, final out. Answer, A. First in, first out. This question assesses knowledge of common inventory management principles within a pharmacy. FIFO is a widely used acronym, standing for First In, First Out. This principle dictates that the oldest inventory items, those received first, should be dispensed or used first to minimize waste due to expiration. Implementing FIFO helps maintain product quality and reduces financial losses from expired medications. Always rotate your stock to ensure the oldest items are used before they expire. Question 22. Which route of administration is primarily intended for a medication applied to the eye? A. Otic. B. Topical. C. Ophthalmic. D. Sublingual. Answer, C. Ophthalmic. This question tests knowledge of different routes of administration, specifically focusing on a site-specific application. The term ophthalmic refers exclusively to medications intended for administration to the eye. Other options like otic, ear, or topical, general skin surface, are distinct. Correctly identifying routes of administration is essential for proper labeling and patient counseling, ensuring medications are used safely and effectively. Question 23. What is a deductible in the context of prescription insurance? A. The amount the insurance company pays for a prescription. B. The amount a patient must pay out of pocket before their insurance plan starts to pay. C. The fixed amount a patient pays for each prescription after the deductible is met. D. The total annual limit an insurance plan will cover for prescriptions. Answer B. The amount a patient must pay out of pocket before their insurance plan starts to pay. This question assesses understanding of basic insurance terminology, which is crucial for processing prescription claims. A deductible is the initial sum of money a patient is responsible for paying for their healthcare services, including prescriptions, before their insurance coverage begins to contribute. Understanding deductibles helps pharmacy technicians accurately explain patient costs and process claims. It's the hurdle you clear before your insurance really kicks in. Question 24. A pharmacy technician receives a prescription for Lantus Solostar 100 units/ml, inject 20 units subcutaneously daily. How many days will a 3 ml pen last the patient? A. 3 days. B. 15 days. C. 5 days. D. 20 days. Answer B. 15 days. This question assesses the ability to calculate the day supply for an insulin pen, a common task requiring careful attention to units and volume. A 3 ml pen, with a concentration of 100 units/ml, contains a total of 300 units, 3 ml times 100 units/ml. If the patient injects 20 units daily, divide the total units by the daily dose. 300 units/20 units/day equals 15 days. Accurate day supply calculations for insulin are crucial to ensure patients have an adequate supply and to prevent gaps in therapy. Question 25. What is medication reconciliation? A. The process of dispensing medications to patients. B. The process of resolving discrepancies in medication lists during transitions of care. C. The process of destroying expired medications. D. The process of ordering new medications from a wholesaler. Answer B. The process of resolving discrepancies in medication lists during transitions of care. This question focuses on medication reconciliation, a key quality assurance and patient safety practice. The concept refers to the critical process of creating the most accurate list possible of all medications a patient is taking and comparing it against the physician's admission, transfer, and discharge orders. This helps identify and resolve any discrepancies, such as omissions, duplications, or incorrect doses, especially during transitions of care, e.g., hospital admission or discharge. Medication reconciliation significantly reduces the risk of medication errors and improves patient safety.